Hi children, welcome. Welcome to today's social science class. Today, I am going to start a new lesson that is Premier Politics, second chapter, Role of the Government in Health. In a democracy, people expect the government to work for their welfare. This could be through the provisions of education, health, employment, housing, or the development of roads, electricity, etc. In this chapter, we shall examine the meanings and problems related to health. What is health? We can think of health in many ways. Health means our ability to remain free from illness and injuries. But health isn't only about diseases. You may have associated only some of the situations in above collage with health. What we often ignore is that fact that each of the above situations is related to health. Apart from diseases, we need to think of other factors that affect our health. For example, if people get clean drinking water or pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or how to live in dirty conditions, they will be prone to illness. All of us would like to be active and in good spirits in whatever we may be doing. It isn't healthy to be dull, inactive, anxious, or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of our lives are a part of health. Healthcare in India. Let us examine some of the aspects of healthcare in India. Compare and contrast the situation expresses in the first and second columns. India has the largest number of medical colleges in the world and is among the largest producers of doctors. Approximately 1,50,000 new doctors qualify every year. Healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 hospitals in India. In 1991, there were 11,174 hospitals. In 2000, the number grew to 18,218 hospitals. India gets a large number of medical tourists from many countries. They come for treatment in some of the hospitals in India that compare with the best in the world. India is the fourth largest producer of medicines in the world and is also large export of medicines. Children, all these things are positive aspects of Indian medical system. Besides this, there are a lot of negative aspects that we can let us discuss. Children, the second column is expressing our negative aspects of Indian medical care system. The most doctors settle in urban areas. People in rural areas have to travel long distance to reach a doctor. The number of doctors with respect to the population is much less in rural areas. About 5 lakh people die from tuberculosis every year. The number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and this number isn't decreasing. We are not able to provide clean drinking water to all. 20% of all communicable diseases are waterborne. For example, diarrhea, worms, hepatitis, etc. Half of all children in India do not get adequate food to eat and are undernourished. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and service that patient need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illness. We also need the medicines and equipments that are necessary for treating patients. These facilities are required to take care of us. Okay, children, I'm going to wind up today's video. And today we discuss mainly role of the government in health and about the what is health and healthcare in India, positive and negative aspects of Indian healthcare system also we discuss. So now you have to read this portion many times and underline important points. Then to given works. Thank you. Thank you to listening my class.